Good evening, everyone, and welcome to our National Women and Girls HIV/AIDS and Awareness Day panel. My name is Siobhan Moore, and I am the chair for the International Awareness and Involvement Committee for the Henrico County Alumnae Chapter of Delta Sigma Theta Sorority Incorporated. It's a pleasure to have you with us here this evening as we discuss this important topic, and it is a pleasure for us to be partnering with Seeds of Healing organization to have a lively discussion on this topic. We will have a dedicated question and answer session, but the event will be interactive. So you'll have an opportunity to participate in some polls throughout the event, in addition to asking your questions as the event progresses along. We are going to have the welcome brought by the second Vice President of Henrico County Alumnae, Soror Melissa Smith. Thank you.
Good evening, everyone. Thank you so much for taking time out of your busy evening to spend with us. I am excited about our panel discussion this evening, and I hope you are too. I bring you welcome and greetings on behalf of our president, Soror Rolanda Thornton, and the rest of our chapter members of the Henrico County Alumnae Chapter of Delta Sigma Theta Incorporated. Again, I say welcome and thank you all for participating this evening.
Good evening, everyone. My name is Paris Williams. I'm one of the co-chairs of the Physical and Mental Health Committee, along with Sorority Page. On behalf of the Physical and Mental Health Committee, we would like to thank you all for joining us tonight, and to our panelists and Seeds of Healing who are taking the time out of their evening to speak to us about an important topic that greatly affects our community. The purpose of this panel discussion is to acknowledge National Women and Girls HIV/AIDS Awareness Day, which is recognized on March 10th. We hope that everyone leaves this panel discussion with a better understanding of the prevention and impact of HIV on women, and how we can show support for women and girls who are living with HIV. And now without further ado, I will pass it on to Soror Tina, who will introduce our first speaker.
Greetings. Dr. LaShonda Wallace is an advanced practice nurse at Novant Health, founder and executive director for Seeds of Healing. Dr. Wallace's advocacy and services focus on achieving health equity and improving health for marginalized populations. Seeds of Healing, known as SOH, is a not-for-profit organization that provides HIV prevention services and promotes retention and care for Black women living with an HIV diagnosis. The core values of SOH are awareness, assistance, advocacy, and by the HIV epic to resources so they will strive. Dr. Wallace's leadership guides SOH to advocate for policies that address health and social needs and build alliances that synergize the commitment to sustainable change. Please welcome Dr. LaShonda Wallace.
Thank you so much for that warm introduction. First, I would like to thank Delta Sigma Theta Sorority Incorporated, who are my sisters of the Divine Nine. I am a Zeta. I want to thank you all for having us all together on this panel today to acknowledge National Women and Girls HIV and AIDS Awareness. You all are providing an opportunity for all women, their lovers, and friends to embrace this conversation and be empowered to support their sexual, mental, and physical health. At Seeds of Healing, know that SEED stands for Sustaining Empowerment by Educating and Developing Sisters. Our mission is to deconstruct the myths that perpetuate HIV and AIDS stigma, generate support for people living with or affected by HIV, and to eliminate the disparities in HIV outcomes for women. HIV and AIDS disproportionately impacts cisgendered Black women, and the incidence rate for Black women with an HIV diagnosis is 11 times the rate of our counterparts of white women and 4 times the rate compared to Hispanic women. HIV is most commonly transmitted to women through sex behaviors and heterosexual relationships. So today, we're going to disclose those reasons why the disparity in HIV and AIDS exists for Black women and get us all on the path for wellness. So before we start, I do want you all to know that if you have questions or want to leave comments, you can leave your chat box. Your message and comments in the chat box. However, if you want those questions and comments to remain anonymous, please use the Q&A function. So without delay, I also want to introduce our other panelists. You have Ms. Samantha LaJoy Kane, who is also a Delta. She is a trailblazer that stands between faith and justice. Samantha has the heart to encourage marginalized individuals to navigate their life stories to produce the greatest versions of themselves. Her work within the community allows her to play many roles, all of which focus on outreach, empowerment through education, activism, organizing, and dismantling systems of oppression. Samantha serves on boards. She is a leader in the faith community and has played an instrumental role in the Violence Intervention and Prevention, LLC's current research project that is entitled, Who Will Survive in America? The Impact of Social Injustice, Police Brutality, and Systemic Racism on Underserved Communities. She is an exemplary role model and advocates for liberation and social justice. Samantha works tirelessly at refining processes, policies, and programs that support the uplifting and oppressed and marginalized communities. Thank you for being here, Samantha. Bonita Spratley. Bonita Spratley is a cisgendered Black woman living with HIV and AIDS diagnosis for over 30 years. Bonita has been an advocate working in the field of HIV for over 20 years. She has rendered services in prevention as well as clinical settings and has a passion for working diligently with those who are newly diagnosed and their families. Bonita helps to fight the stigma, she embraces this HIV journey with a positive perspective so that individuals will thrive and live healthy through self-care, medication adherence, and connecting their management with their medical professionals. She also has a passion for connecting those living in silence with others alike. Bonita joined our board at Seeds of Healing to support our initiatives and give her input as meaningful involvement in a person living with HIV and AIDS, and she sits at the table and uses her voice proudly. Bonita facilitates programming for Black women who have an HIV diagnosis for Seeds of Healing, and she moderates the online social platform. Bonita produces webinars that she and her peers can benefit from, and with her presence at monthly group engagements. Welcome, Bonita.
Thank you for having me.
Yes. So as we get started, the first thing we want our panelists, as well as all of those who are attending as attendees, to participate in a poll. And this poll is going to be just a pre-assessment. And the pre-assessment we will do again at the end, just to see how aware you are in regards to HIV awareness. So here we go. Okay, we're going to end the poll. I do believe that we did get the majority of those who are present with us to participate. We have over 90% participation. Thank you all. And now what we're going to do is review those results. And the results I'm not sharing in regards to knowing how much you all are aware in regards to, how much education you have, but to understand the awareness about HIV. And so when we ask the questions, how HIV cannot be spread, 79% of the participants got that question correct. HIV cannot be spread by a mosquito. Do people with HIV show severe signs of illness? 98% got that question absolutely correct. And if someone was pregnant and was HIV positive and treated early, the risk of their baby being born with HIV is actually less than 1%. So the responses to that were a little varied. And the next question, everyone got correct. A person living with HIV can look and feel healthy. And have you ever heard of PrEP, pre-exposure prophylaxis? 66% of those of us who are here today actually got that question correct. And lastly, do you believe that you can contract HIV if you come in contact with saliva or a person living with HIV? And 77% of our participants disagree. Thank you all for taking that poll on HIV awareness. And I believe that if we do that poll again at the end of this session, we're going to get 100%. And that is why we are here, to stomp out stigma as well as improving HIV awareness. So getting this conversation started, it's going to be like a round robin. It's going to be me, it's going to be Miss Benita, and it's going to be Miss Samantha. And together we're going to just have a conversation. And through that conversation, you all are going to become very much more informed. All right. Mm-hmm.
Yes, go ahead and ask away.
Okay, so Benita, we've already shared your bio, and we know that you are living out loud in regards to being HIV positive. Can you tell us more about why you chose to be an ambassador about this topic on National Women and Girls HIV and AIDS Awareness?
Absolutely. Well, besides being diagnosed for over 30 years and working in the field, I have an extensive history on drug use and HIV, which is one of the ways that I contracted the virus. I was a part of the 80s, 90s crack epidemic. So not only did I have to deal with the diagnosis, I had to work hard to, get my head together and get myself off of drugs. I've also been non-adherent to my medications at some point in time earlier on when I started taking medications. So I could speak to that, and having children while being HIV positive, also getting married and working in the HIV field. And so I have a host of things that I can share with people, and not only be an ambassador for National Women and Girls Day, but HIV overall. I'm thriving. For me, I have overcome all of the barriers to treatment, the stigma, the myths and misconceptions that people would think that there is not life after an HIV positive diagnosis. And I'm one of those ones that have disclosed, and I'm living out loud. So I don't mind sharing my HIV status and how I've gotten over and begin to thrive over the course of the years.
Thank you, Ms. Benita. It is such an honor and a pleasure to be here with you. And thank you for sharing your history, your story.
You're welcome.
Samantha, go ahead.
Ms. Benita, may I ask, what made you want to live out loud after being diagnosed with this illness? What made you want to be an advocate? What made you just step out there and share your story?
So that's funny. Thank you for asking that. So I'm a rarity because I was diagnosed in 1990, and I was diagnosed 3 states away from where I was born and raised. And I had no idea that there was a stigma um, attached to HIV. And so when you get information, most of the times in your life that is as serious as HIV, most of the time you share it with your loved ones or, friends and family. And so I began to do that, much like if you were told that you had cancer, um, I shared it. And so before I realized that there was a stigma attached to it, the cat was well out of the bag. And so I just continued in, it wasn't something that I could take back. And because I think that I was bold and daring in my crack use, like I didn't hide that. And that's something that, people kind of try to, hide and keep quiet and stuff for as much as they can. I think because I pretty much lived out loud with that, it wasn't hard for me to continue in advocacy and sharing about stigma, which was one of my what my first speaking engagement was on, and then getting into schools and women's shelters and churches, and it continued on into doing what I'm doing now.
Thank you so much for sharing that.
Absolutely.
Samantha, I was going to ask you the question next. First, I think that we've probably already shared some of this information, so I'm going to be completely transparent with our audience in regards to your knowledge of your status. But what did you find the reason for why you thought it was important for you to be here today? And you can also, share with our audience your status, since our panel was intentional to have those who are impacted and affected by HIV, as well as those who do not have personal lived experience.
So I am an HIV negative person. So I don't live with this I don't know, how you want to term it or how individuals term it. So I try to be careful with that. But I am HIV negative. And the reason I thought it beneficial to be here is because specifically in the Black community, we don't oftentimes talk about health. We don't oftentimes talk about sexuality. I grew up in the Black church. I am a part of the Black church now. And oftentimes, sexuality is still a taboo topic. But HIV and AIDS is something that hits our people, that we need to educate ourselves on. If we're not educated on this topic, we don't know how to prevent it. We don't talk. So I believe that this conversation is necessary within our community, and it's a healthy conversation to have.
I like how you started one. You were very concerned about what words you were going to use and how you were going to describe HIV and what you were going to call it and speak to it, because words do matter. Words matter. And I think Benita can always expound upon that with us and for us because of her lived experience, how stigma is actually perpetuated because of words. Benita?
Yes, it is perpetuated because of words, and words hurt. It also carries a huge stigma behind it, which keeps people from, number one, being tested. It keeps people from accepting their diagnosis once they find out they're positive, getting into care, taking medications to keep themselves healthy. Also, people live in denial because of stigma, and they don't take care of themselves and continue to have condomless sex, which, is why people continue to, one of the reasons why people continue to contract the virus. And so, yes, words do matter. Uh, we have a HIV community that is a stickler for making sure that you say things in a respectful way, like we're human, and we don't
You froze, Benita.
disrespect it. No one does, but
One of the things you may notice that Benita does, Benita does not use infected. Benita uses the term contracted. We use the term in this HIV work transmission, contracted. However, the term infected itself can be stigmatizing. So thank you for sharing just now, Benita. And Samantha, you disclosed that you are HIV negative. Was there ever a time that you were hesitant to learn your status? Why or why not?
I will say that there has never been a time where I've been hesitant to share or find out about my status or share my status, of course. And I'll say that because I think conversation and communication is important. You know, we talked about having unprotected sex without condoms, sex without, preventative measures. And I think that that's an important topic. That's an important conversation as well. What are you doing to protect yourself? What are you doing to protect your partner? What are you also, what are you communicating? Are you being open and honest? And are you in a trustworthy and healthy relationship? And I think communication is key and vital when it comes to talking about your status as far as any STDs, STIs, AIDS, and HIV. So I believe that's important.
And just to add to add a little bit more, when we were talking about stigma, we want everyone to understand that stigma surrounding HIV and AIDS, it exists. And it is so important to reduce stigma because it perpetuates a false narrative. It's also a distraction. So if we are not sharing the true story about the impact of HIV and AIDS in our community, society did not have the time and the opportunity to enact policies so that we can prevent new cases of HIV transmission. It also perpetuates the opportunity for shame and blame when we all are responsible for our sexual health. And so stigma, it actually keeps us vulnerable to contracting and transmitting HIV and AIDS, and it isolates those who really do need help. And that is what I'm hearing from what we all have just shared. So Benita, how do you encourage someone who is living with HIV, who is hesitant about getting support or seeking care? Because I heard that you mentioned that that can be a challenge.
yes, and I apologize for my connectivity before, but encouraging someone, I would just say, know that there's a whole HIV community that's out here, and we are a close-knit family, compassionate about the work that we do, and we're here for you when you're ready. There are several local and national organizations and support groups that are here to help you cope and manage this journey. And one is Seeds of Healing has a women's hybrid support group that we have every third Wednesday at 5:30. And if you can contact Seeds of Healing if you would like to be a part of that. And also we have the web-based platform for Black cisgender women called Soul Time, where we have an on-site blog for those that are registered. We also have tools of self-care and nationwide events to stay abreast of what's happening in the HIV community, and a host of other tools for wellness and empowerment. But just know that, like I said, there's a large group of us, and we welcome you when you are ready to be a part or receive that social support from those that have lived experience.
I love that you share, Miss Benita, that you say, you know, you're here, or this community is here to support you when you are ready. So my next question is, what are some ways in living in silence and fear, you know, defeats us as people? Why might someone not be ready to disclose, or why might they live in silence and fear after they've been diagnosed and not reach out to the community that is there to support them?
Most of the time it's the shame, it's the guilt, is the stigma that's attached to HIV. And we have a saying in the HIV community that silence equals death, where you know that silence breeds depression, loneliness, isolation. And a lot of time, people are just afraid to open up. They don't have that support system. They themselves were people that may have spewed some of the stigma before they found out they were diagnosed, and now they find themselves on the other side of the track, and so they know what's being said out there. And but you can live. You can live a normal life after being diagnosed. And for us, HIV is just like someone being diagnosed with high cholesterol or high blood pressure. Like those health issues can be detrimental too if you don't take your medications and go to the doctor as you're supposed to. So we are doing our best to try to normalize the conversation of talking about HIV, because it's a health condition. HIV, though it is an STD, does not come to gross out your private parts, but it affects your immune system. And that's something that you cannot see. But if you don't take your medications, there can be signs and symptoms that develop that if you have not disclosed, people will begin to ask you what's going on. So it behooves you to take your medications and stay healthy so that you know, you are able to share that information when you are ready.
That point that you made, Anita, about living with other chronic ailments that we are aware of, like diabetes or hypertension. You know, if someone does not take their diabetes medication, or if they have not been diagnosed, they start to present with symptoms, right?
Mhm.
They start to lose weight. They start to have increased urination. They can go blind. Sometimes people will lose a foot. And if someone is living with a diagnosis of cancer and it goes untreated or misdiagnosed or missed, they may start to feel or have deterioration of health. Well, HIV is a chronic ailment, and that's basically what you have said. It is a circumstance that once someone is diagnosed, it can be treated, and as soon as it is treated, that an individual can live a healthy life with treatment and access to care.
Yes, and thanks, because early detection is key. So if you feel like that you have been exposed to HIV, don't mess around, like go get tested. And if you find out that your test is positive, please get into care. You know, don't linger around and not get treatment because your immune system is in danger and you don't want to expose anyone else, and you want to stop it where it is with you.
Now, there are some basics, so you know, and that's what we're going to call it. And so we're going to do another poll because we have like another half of this to continue talking about, a lot of knowledge to share. So I want to share this next poll. It's called So You Know, and we want everyone to have the opportunity to answer these questions. Again, the questions are anonymous, and the questions will give us some insight into how we all are vulnerable. We are humans, and humans have innate behaviors, desires, and So we want to know, so you know.
Dr. Wallace, we do have some questions coming in the Q&A when you have a moment to address them.
Yeah, of course.
Thank
So
you.
after we get these questions going, then we'll go ahead and do our Q&A. And thank you all who have sent questions and to join the conversation. So the questions are you a man who has had sex with another man? Have you had more than one sex partner since your last HIV test? Have you injected drugs and shared needles or works, for example, use works such as water or cotton for needleworks with others? And have you been diagnosed with or sought treatment for another sexually transmitted infection? And have you ever been diagnosed or treated for hepatitis or tuberculosis? And have you had sex with someone who could answer yes to any of these questions, of someone whose sexual history you did not know? And so now that we have 89% of the participants, we're going to end this poll, and then we're going to share. And if you can answer yes to any of these questions, then you are vulnerable to contracting HIV. And as you can see, there have been some yeses, and now we're going to stop sharing. Thank you all for participating in that. And now, okay, Siobhan, you want to help us with the questions?
Yes. So the first question is, what are some coping skills to manage the psychological impact of HIV?
I would have to say, for me, coping skills was, first of all, getting into care and talking to my HIV care provider. Like he immediately cleared up all of the anxiety and questions that I had about was I gonna die, and what kind of life I would have, and gave me resources to connect to support groups, and just overall assured me that I could have a normal life after being diagnosed. And so also being in support groups, being around other women with lived experience, hearing their stories, being a part of trainings and webinars, and just, you have to really just walk this out, because everybody's journey is different. And just keeping myself knowledgeable and around those that had been diagnosed, that were coping skills for me. Aside other stuff like meditating and journaling and affirmations, speaking affirmations to myself. So aside from those things, definitely getting into the doctor and getting my lab work, and getting the good results when he would tell me that your numbers are looking good, like you're undetectable, and we know that U equals U now, which is undetectable equals untransmittable, that you cannot pass the virus on to someone if you have undetectable. If you are undetectable. And so my virus has been suppressed for over 20 years. So that's a plus for me. But just hearing stuff like that and keeping yourself abreast with the different changes and stuff, those things help me to cope with, and knowing that I can continue on to have children and get married and have relationships, those things brought solace to me.
Great, thank you. And we also had, just to piggyback on that, we had a comment from a participant here that stated, it's acceptance of you, yourself, and living out loud. So I think those are things they're offering that also help cope. So the next question is, what are some of the changes in mental health among people with HIV during the COVID-19 pandemic?
I want to just, I don't know if Benita was going to say anything, but our organization did have the opportunity to do a community-based participatory research project with a sister from Elon University and another sister from North Carolina Central. And we actually assessed specifically Black women in the South. And what we did learn that there was fear, anxiety during COVID-19, in the sense of the fear that contracting COVID-19 was going to exacerbate individuals' health concerns. Additionally, with the fear and isolation, participants also shared that there may have been challenges with their medication adherence because of the impact that the mental health concerns that they were having and experienced during COVID-19. And what do we know happens when people have challenges with keeping up with their medical regimen? That can impact their health outcomes. COVID-19 created challenges with having access to routine appointments, having access to transportation. It impacted employment. And all of those layers did impact the mental health and well-being of those who was living with an HIV diagnosis. And that is why we launched SoTime. SoTime is a human-computer interactive platform. It's sort of like a Facebook page for Black women who are positive so that they could stay connected and support each other with resilience and coping measures to keep each other uplifted during the time of COVID-19 pandemic.
Great, thank you. The next question. I read your background on your website. Can you share your story about how it was having a mother who was positive, Dr. Wallace?
I've never gotten asked that question on a public webinar, but I do appreciate it. And this is definitely why I am here. My mother was diagnosed with HIV when I was 15 years old. And when I learned that my mother was living with HIV, I was her confidant. My mother was a teenage mother, so she was young. My mother was 32. I think that was when I really took on a role of a caregiver, a confidant, especially the closeness that women and as a daughter could have. My mother's experience was that she did not initially take to care. My mother was a born-again Christian. She relied heavily on faith. What I do know now, and I will tell someone else in the room, is that faith without work is dead. And my mother only relied on faith, and she had a mistrust in the healthcare system that many of us as Black and Brown individuals do have. And because of that, she delayed treatment, and ultimately she did succumb to HIV and hepatitis C. What I do now, I use my mother's legacy as a matriarch in our family, as a woman of faith. And she was a wonderful, wonderful person, not just because she was my mother, but because of who she is. And that's why I keep her uplifted to this day. But I use that to, that's my reason, that's my why. Because I know that it was her misunderstanding. I know that it was stigma. I know that it was fear that paralyzed her. And before my mom died, a couple days before she died, she decided to attend one of the groups that I had kept trying to encourage her to attend. And she said, I want to talk about it. You know, I want to make sure that no one has to go through what I went through. But unfortunately, it was 2 days before her death. And so I've chosen to live out my career and my life to support those who may have maybe walking in her shoes. So thank you for asking me that question.
Yes, and thank you for that. That's wonderful that you were able to get her to finally attend the sessions and to continue to do the work in her honor and her memory.
Thank you.
The next question is for you, Ms. Benita. What role has your family played in supporting your HIV diagnosis? It's a multiple part question. What role has your family played in supporting your HIV diagnosis? How has your diagnosis impacted your family as it pertains to family gatherings, hugs and kisses, etc.? Is there still a level of fear from family members?
If there is, I don't know about. No one has come to me as a family member and expressed their fear. If they had any fear, they did it, behind closed doors. I was never presented with paper cups or plates or told, like you can't use my restroom, or I don't want you here at the house, or you can't, come to the cookout. I've never experienced that from my family. My mother and father are deceased, but my mother, which was the backbone of the family, she supported me wholeheartedly. She took me to and from my doctor's appointments before she passed away. She was also there when I had my first and second daughter. She passed 2 months after I had my second daughter, but yeah, she supported me wholeheartedly. Like, that was my mom, and she loved me wholeheartedly. And listen, she put up with me through the crack epidemic. I put her through some really, treacherous things during those years. And she was not surprised when I contracted the virus, but she was there for me to help me. She didn't expect that I would live, because a lot of people were dying as they were getting diagnosed back in those days, and they weren't living that long. And so, but she stood by my side, and so did my father.
Such a blessing to have parents and daughters, or children in your case, Dr. Wallace, to stand by your side in such a time as this. Yeah. So the audience members are appreciating you all being vulnerable and transparent, and are highly appreciative of you sharing the information. And so the next question is, are you seeing higher transmission rates with the young adult population, specifically ages 13 to 25?
I will share that some of the data during COVID got a little skewed, and rates appeared to seem like they were going down. And we don't know if we can actually trust that information, because a lot of people was not out getting tested. But what we do know of is, as of 2019, the estimated number of new cases for the second leading age group was those ages 13 to 24. So, and then the highest leading age group for new infections, new transmissions, I have to catch myself as well, was the age group of 25 to 34. So I do not have that information specific to girls, but the age group within itself is significant to share. In 2019, also be aware that although there was less than 1% of vertical transmission, and that is from a mother who is HIV positive, who have a detectable viral load and not on medicine, a perinatal transmission. In the United States, there was 84 circumstances. And out of those 84 circumstances, we need to know that 61% of them were among Black families. So yes, 61% of them were among Black families. So there's a lot of work that needs to be done in regards to making sure that everyone, and especially those who are disproportionately impacted, understand prevention, have access to reproductive health care, which is sexual health care. And access to health care in general, with healthcare expansion and access, so that they can be screened. And if, unfortunately, if someone is positive, they can fortunately be connected into care. What we do know is that mothers who are on treatment, or individuals who are pregnant are on treatment and have an undetectable viral load, that it is less likely that their child would be contract HIV.
I have a question. I'm sorry. So
Mhm.
as we've been having this conversation talking about, stigma and talking about, HIV being able to be transferred from a mother to a child, I'm
Mhm.
just about, being in school and coming up in school. And I remember having a classmate who had contracted HIV from his mother, from the birth canal, just being transmitted from his mother, and how
Mhm.
as a person, how, children can be kind of rude, kind of rough sometimes, and how because we as young people didn't have a clear understanding of what it meant to live with HIV, we also had, gained our own stigma or developed our own stigma around how to treat this young man. So what would you all suggest? Some of you all may be mothers. What would you all suggest is an appropriate age to start having these type of conversations with your children? Because it is something that they are facing within the school systems, and something that, can ultimately impact their lives as well.
For me, it was as soon as I felt like my child could understand, like they are exposed to so much through social media nowadays, and we didn't have that issue in our time. I was born in the 60s, and so yeah, you have to get ahead of what they're going to be exposed to, and to dispel the myths and misconceptions, and to make them aware of what is out there, and to know that you may be going to school with someone that is diagnosed with HIV, and to treat them with respect. I think most Black families, especially those that are in the South, have that Bible Belt mentality, and we have to, we were taught to respect, other people, and so I don't think because of an illness that you should treat anyone any different. You never know when you're going to end up on that side, and I've seen it so many times.
I want to just say thank you, Ms. Bonita, for those comments. When we start to have conversations with our children about their sexual health and understanding their bodies, I will believe that it is soon enough to talk about sexually transmitted infections and not just HIV. As soon as we can say to our children, don't bring a baby home, don't get someone pregnant, that's the same time that we need to be having conversations about HIV. And so we had over 50 people on this webinar who was chimed in. And I would say, you look in the mirror, when were you first curious about your sexuality, practicing your sexuality, performing intimacy? Those are the same ages that we need to be having the conversation with our children about transmission of sexually transmitted infections. It's important to know that HIV does not have a look. HIV look like me. It look like you. Look at Miss Bonita, with her beautiful face, brown, full face. And the reason why I say that is because people think, oh, somebody lose weight or they have sunken jaws. Oh, something must be wrong with them. You cannot tell who is living with an ailment. So we want to make sure that our friends, our children, our family members, community members don't think that you can go in a room and pick out who you want to have unprotected intimacy with. So HIV is not a moral issue. It is not due to promiscuity, meaning having multiple sexual partners, although that will increase your vulnerability for infection, but it is a sexual health and it is a wellness issue. And those are the conversations that we need to have with our children and our family.
So just to piggyback off of that topic, there's another question for you, Ms. Bonita, that says, as an advocate, how do you educate a teenager about condom use and the importance of practicing safe sex?
Oh, we've been talking about that over the past week. You just like LaShonda just said, you have to, just get in there and be open and honest with them about the vulnerabilities of contracting HIV and any STD, and having children that you may not be ready to take care of. Like, I think it's a total package that you would open up a conversation about. And so I'm one of those ones that, like, I just talk, I just say it, you know, I don't have any fears or any hesitancies of talking to youth if that opportunity was presented to me. So, but I don't know that, like, they're so different nowadays. So, I mean, that would be my approach, just to open up a conversation, you know, about the vulnerabilities and all of the things out here today.
Yeah, and I think that goes along with another comment that's here. It says that Dr. Ashley Nelson research work is centered on mother-child transmission. And the participant said that she'll connect her with seeds. And Dr. Nelson always says education is key, especially in the Black community. So I'm just putting the education out there.
Mhm. Thank you, Siobhan.
Yes.
One of the things that we did not say, and I want to make sure that everyone knows, that transmission of HIV is through blood, semen, vaginal fluids, and breast milk from someone who has a detectable viral load.
Right.
Okay. It is not spread through tears, mosquitoes, nor sweat.
Yeah, no casual contact.
Okay, this is a little bit of a topic that I know I haven't heard discussed before. The question is, if there are any, how are naturopathic and or homeopathic therapies incorporated into the holistic care and treatment of those living with HIV and AIDS?
But thank you for that question. First, I want to disclose that I have lived experience of my mom since I was 15, watching her do only homeopathic remedies to save her health. And I've been caring for people with the diagnosis of HIV since I became a nurse in 1996 at the bedside, in the height of the epidemic when a lot of people were losing their lives. So, homeopathic remedies are supplements. They are not treatment. And I will say that again, homeopathic remedies are supplements to having a healthy life, a healthy lifestyle, incorporating wellness. However, it does not cure HIV. It may improve your quality of life and make you feel better and healthy and supplement your vitamins and minerals. However, at this point, the only remedy that we do have to treating HIV is medication. And until there's a cure, I would encourage anyone who is positive to take medication, conservative, what we do know, because it does work, until we know more. And the reason why I just stress that, because I have not only watched my mother health fail, and that was a cause of her detriment, only relying on homeopathic remedies and her faith. And unfortunately, what works is the medication.
An audience member says that they love your honest answer regarding the homeopathic support. So thank you.
Yeah.
Next question, Miss Benita. Did you have any resent after contracting HIV?
Well, of course, in the initial years, but as I continued on in life, no, because it did not stop the quality of life that I've had. Like, I've been resilient. I've bounced back. I've had 2 near-death experiences. One because, I thought my faith could, heal me. And yeah, I've had children. I've been married. You name it. I've done it. And so I don't resent it at this point. I'm still here.
Yes,
Yeah.
thriving.
Mm-hmm.
Can I add a little bit with that?
Absolutely.
And I care for people all the time. And I will tell them when they go down that rabbit hole about resentment, understand that our wellness and our self-care is everyone's responsibility. So we have to inform and educate our children, our girls and our boys on sexual health. We need to anticipate that our health providers are going to query us about our sexual health and our vulnerabilities to having poor health. They need to find out what is getting in the way of us from being well. Do we have healthcare coverage? And that is to our leaders and politicians who make decisions on policies. Do everyone have housing security? Because when people have to compete with priorities to live, they become vulnerable. And intimate partner violence, that's another vulnerability. So prevention and ending the epidemic is everyone's responsibility. We can say, oh, now I understand what people say, oh, well, they knew. But I will tell you something about people knowing their status. There are many states where people do not have to disclose their status, all right? So if someone is undetectable and they are in care, they are not posing a harm to you because undetectable is untransmittable. And some people may be like, what? But think about it. A mother can have a baby. A mother can be undetectable and do not transmit HIV to her unborn child. And that is remarkable. That is remarkable. But we are all responsible for our sexual health when we decide to be intimate. And again, those things that make us vulnerable are things that compete with how we care for ourselves, and then we compromise best sexual health practices. And those are the things that we need to be talking about with our leaders and those people those structures and systems that keep barriers in place.
Thank you, Dr. Wallace. So just a point of clarity regarding the homeopathic and holistic healing. They say that, I think my question was either unclear or misunderstood. Mm-hmm. I'm aware that it's not a cure. I'm just addressing holistic and naturopathic treatment being incorporated with standard treatment because medications have side effects and adverse reactions. So I think kind of similar to what you said. Go ahead, you can go ahead.
Well, I'll expound upon that. Blood pressure medicine has side effects. Insulin has side effects. Chemotherapy has side effects. However, when we take HIV and HIV medications and we only put those factors surrounding HIV, whether you are aware of it or not, whether you are conscious of it or not, and I'm not necessarily talking to that participant, I'm talking to everyone, that is stigmatizing HIV, right? So when we take our blood pressure medicine, do we take a vitamin to counteract the effects? Maybe, maybe not. But the conversation comes up when it's surrounding HIV. But yes, I do appreciate that input that, yeah, homeopathic, normopathic medications, they do contribute to a quality of life, no matter what the ailment is. It doesn't matter if it's HIV. It could also be diabetes. It could be living with hypertension or cancer. If you want to supplement your health regimen, do so in all cases. But when we isolate HIV, that is stigmatizing.
And Dr. Wallace, I know we've been talking about medication and prevention, and from the first poll, could you speak a little bit more about the PrEP medication or the PEP medications?
Oh, sure. So pre-exposure prophylaxis, that's 1 pill a day. They do have newer versions that have came out for pre-exposure prophylaxis. I'm not well versed on them right now, so I'm not going to expound upon it. But the concept itself, PrEP, is 1 pill a day. Someone who, one, do not know the status of their partners, have multiple sexual partners, or maybe they do know the status of their partner, their partner may be positive, they can take PrEP to prevent contracting HIV. It have to be done before intimacy or exposure to the virus. Additionally, there is post-exposure prophylaxis. So if someone have a circumstance where they may have been exposed, it could have been through a needle stick, accidental, because we experience that in a healthcare setting or in the industry doing environmental work all the time. It could unfortunately be a sexual assault. You can actually seek medical care within 72 hours and get post-exposure prophylaxis to prevent transmission and contraction of contracting HIV.
Within 72 hours, I think.
Right. Within 72 hours. And there is a time frame of pre-exposure prophylaxis that people can prepare if they are going to potentially be in a circumstance where they don't know whether or not their partners may be positive. But again, I treat, persons who are living with a diagnosis. But your primary care provider, general practitioners, if they hear that someone that they're caring for can answer yes to any of those questions that we did in the poll, then PrEP should be offered or at least become a part of the conversation. And what we do know is that although Black women are disproportionately impacted by the epidemic, less than 10% even have access, aware of, or offered PrEP as a prevention method. And that is a tool in our toolbox along with female and male condoms and dental dams.
And I believe on your website, if someone wants to check that out after this, there is a phone number that they can text in order to get HIV screening and PrEP.
Yes. Yes, they can contact us. If you're in our region, we are in New Hanover County, in North Carolina, and we also do screening services in Brunswick County in North Carolina. And if someone needs access to PrEP, we will make sure that we connect them with a PrEP provider.
And just to piggyback on that, we do have resources here in Richmond as well. For those of you here in Richmond, one of our partners is Nations Foundation. If information is needed, we can definitely provide that for you. So a follow-up question regarding pre and PrEP, Dr. Wallace, are the drugs affordable?
So if someone has access to healthcare, it is achievable, right? They can have access to it. So that is a challenge, but the pharmaceutical industry, they tend to have programs that will provide PrEP to you. All insurances do cover PrEP. Medicaid covers PrEP as well, right? So when we think about Medicaid expansion, right, the doors that it opens up for people. So if you do not have access to it, pharmaceutical programs, again, they do have applications that can be completed so that you can have access. And if you get a PrEP provider, they will have the know-it-all in regards to those details.
Great, thank you. Okay, next question is still about treatment. Are there any medications globally that cures HIV? I have a friend who is a nurse. She had a wealthy patient who believed he was exposed to HIV. The doctor prescribed a pill to prevent or fight against the virus. However, it's really expensive and usually only the wealthy can afford this treatment. Is there any pill that exists?
No cure at this time. They are working on that, but no, there's not a pill that can cure. And there are, I think, coupons through the help me out pharmaceutical company that the medications are geared from, and so that will help towards the cost of the medication for PrEP and PrEP.
Tell them about the cure, Benita, because I heard you explain it so eloquently a couple days ago.
Yeah, so there have been 5 people that have been cured, but it was through a tedious process, a surgery called stem cell surgery. They had cancer, and so the surgery was not to cure HIV, but it was to cure the cancer. It just happened that they were cured from HIV as well. People may say, well, why can't we all get a stem cell surgery? Well, stem cell surgery is extremely tedious and it's costly. And so it is something that they wouldn't recommend for each of us or any of us to do.
Great. Thank you for that clarification. Okay. This next question, what are the different tests that help monitor a person's HIV? Also, who should be on your healthcare team?
Good question. So when someone is receiving care for HIV, their HIV viral load is monitored to assure that the medication is effective with managing the HIV. So those who are on treatment have to take their treatment every day. It is recommended that they take their medication at the same time every day. And as a positive result, the virus, once it's controlled and undetectable, it will stop using up your healthy fighter cells. It will stop using up your CD4 cells. And your CD4 cells, they're observed, but medication does not treat CD4 cells, which helps keep your immune system healthy and fight off other infections. So providers will monitor the viral load. There are, of course, other slew of labs that your provider will get, monitoring your hemoglobin, your liver, and your kidney function. But the monitoring is for the viral load.
Thank you. So we don't have any other questions in the chat right now. I know we're coming up on the top of the hour.
Can we do the last poll to see if our viewers and listeners actually, there's a difference in the outcomes? So we're going to launch this poll. It's the post awareness poll. Again, everyone's participation is anonymous, and we want to see whether or not there is a difference in your knowledge since we've been having this conversation. Hopefully we touched on all parts. All right, so let's share these results. So our participants in answering the questions, 100% got it right. HIV cannot be spread through mosquitoes. Excellent. People who have HIV show severe signs and illness quickly. We had about 3% who got that question wrong. So for clarity, if someone has advanced disease, which we also know as AIDS, they may tend to look ill or chronically ill. But again, just like any illness that goes untreated for a long time, that can present itself. HIV is a virus. People live healthy lives with a virus, and no, HIV would not show symptoms, but people showing severe signs quickly when they have the virus, that is false. The next question, if HIV pregnant women are tested early, yes, less than 1% can actually have a child who is born with HIV, and 83% of our participants got that correct. A person with HIV can look and feel healthy. 95% said yes.
Thank you so much, Dr. Wallace, Ms. Benita, Ms. Samantha. Thank you for such a lively discussion, very informative. I think one of the major takeaways, well, the first thing that I wrote down is words matter, but we know that in all situations, right? Words do hurt. The tongue is a powerful weapon. So we always want to be conscious of what we're saying. But then the other big takeaway that I had from this event was education. So educating our family, educating the community, educating ourselves. So that means getting tested and knowing your status. So with that in mind, we want to thank everyone for joining us tonight. Thank you to Seeds or So for partnering with us. Thank you to the committee members of the International Awareness and Involvement Committee, as well as the Physical and Mental Health Committee. We will be sending out an email with a link to a survey just to get your feedback on the event and what we can do better for future events. And in that email, there'll also be some information regarding our March of Dimes, March for Babies walk that we're participating in, and we're soliciting your support in support of that as well. So once again, we thank you so much for joining us tonight. Everyone have a great night. Be safe and be well. Thank you.